there's going to be periods of sadness, periods of anxiety, and it's important to not write it off if it's getting to be something more than its norm. And everyone's norm is different, but if you're having thoughts of hurting yourself, having thoughts of hurting other people, if you can't sleep or eat and it's more than the side effects from the medications, it's okay, and you should talk to your doctor about how you're feeling and also get treatment if it's necessary. As a community and as a society, when we get to talking about mental health, everyone is hush-hush, and that is not going to help you, your 5 kids, or anybody else that is relying on you for whatever source of support that you're giving. So one thing I always say is if we don't take care of ourselves, we can't take care of anyone else. Absolutely. So if you need to get help, get help. The same way that you will go and get treatment for your cancer, we need to feel comfortable getting treatment for our depression, our anxiety, schizophrenia, bipolar, whatever may be going on in our lives, and not keep trying to sweep it under the rug. So I'll leave it at that and pass it on.
Thank you so much, Dr. Powell. So I'm going to, our next panelist is Dr. Frank Voigt.
Yes.
I'm going to read it.
Good morning. Oh, you can read it first?
Sure. You want to jump right in?
I was ready to go, but you can.
No, ready to go, no. I just want to, I'm going to take one quick second and give you a little bit about this, again, amazing panel. Dr. Voigt is a chiropractic and community physician, a leader for personal health and wellness, and a national and international speaker, and about to add author to his list of accolades. He's the founder and owner of Health on Earth Wellness Centers, LLC, in 4 Illinois locations since 2004. And Dr. Voigt received his doctorate of chiropractic from Logan College of Chiropractic in St. Louis, Missouri. He is advanced certified in prenatal, pregnancy, and brain traumatology. That's a good one. So I'm going to stop right there and let you talk a little bit more about your work and why you're passionate about being here.
Well, I think it's still, well, good afternoon, everybody. Definitely excited to be here, and I am a chiropractic physician. My biggest interest, and just I want to kind of piggyback off of some of the things you were saying because I was listening. Mental health is something that is big. And oftentimes it's an underlying cause of a lot of different things after the detoxes and the exercises and the therapies and all of the things. If you can't remove the biggest problem, which is inside, sometimes that can really break the body down. This is where Let Go and Let God comes in tremendously. And the older you get, the more you see its prevalence on a lot of occasions, on a lot of things. But back to chiropractic, one of the things that I really push with my patients is teaching them to thrive, not just survive. Every single survivor in here today, can I get a raise of hands of survivors, raise of hands of survivors? Bless all your hearts, bless you, bless you. Well, each one of your bodies thrived through cancer. It thrived. It didn't survive, it thrived. One of the things that we do with Health on Earth is we teach our patients how to be the lion and not the gazelle. All right? Now, any way it goes, every morning you're going to get up and you're going to be running. You're going to be chasing something. All right? You're going to be growing. You're going to be developing. You're going to be, new things are going to happen, but you have to live. And in order to live, something has to give. So you might as well be the lion rather than the gazelle, and that means thriving. With thriving, one of the things as far as within our community oftentimes are things that we don't look for. In our community, we don't talk a lot about the future. We don't talk about playing with our grandkids. We don't talk about going on retirement and walking in the sand, but we talk about things for the moment. But your life is about a preparation of a foundation that you lay down, okay? Your life is a valuable savings account. And what you put in it each and every single day is what it's going to give back to you in the end. So we have to constantly pour into not only the things that are around us, but within ourselves, because we can't support the space around us or the people around us for our future generations to thrive if that doesn't occur. So my biggest passion is seeing our community thrive. I know for a fact that if our health, the state of health of our community, behaviorally, right, physically, right, chemically, if all of these things occur, as a people we can become stronger and we can rise and our children can rise. There's no reason our children should wake up in the morning and cold pizza and hot fries and sweet pop is breakfast. All right, they've stripped our schools of physical activity and education. That's a huge thing, but you know, I'm not gonna go in there. That's what I do. I am a chiropractor and I wanna see us thrive.
Thank you so much. Ms. Sheila Harmon has over 25 years of experience as a registered nurse and over 10 years of experience as a certified diabetes educator. As an advanced practice nurse, clinical nurse specialist, she is currently the director of provider practice at University of Illinois Miles Square office. She partners with Access Health Community Health Network as a diabetes consultant and educator and serves on the Chicago Community Board for the American Diabetes Association. I'm going to pause there and let Ms. Harmon talk about why this work is passionate and give you some words of encouragement.
Well, it's still morning, so good morning, everyone. As we transition in. So, I am a board member with SWIO. I became a board member because I worked with Beulah Brent, and being a part and also working with Dr. Monica Peak and seeing what this foundation was about and the help and the support that they were giving the women. And so we always joke around to say, I'm very passionate about diabetes, and that passion I had with diabetes is what I saw in Beulah and Kim as it relates to breast cancer awareness. So I'm now a community health educator for breast cancer awareness to go. And so in my practice and being able to see patients for majority of the things I see them for is diabetes, because that's my specialist. So my dad had cancer, but he didn't die from cancer. He died from something else. My mom had cancer, but she's still living and she survived it. And one of the things when people go through chemo, their blood sugars go up. And because of the blood sugars going up, sometimes it requires you to have to go on insulin. And so that doesn't mean that you have diabetes, but people need to understand what the purpose of insulin is. And so in this journey and joining with SWIO is helping people understand about the healthy eating. I was a research nurse at the University of Chicago for about 4 years. And especially in the African American communities, we hate to participate in clinical trials. Why? Because of the Tuskegee experiment and what they did for the men. And they said, I'm not going to be a guinea pig. They're not going to do that to me. And so my job was going into the communities trying to dispel so many myths, because there were a lot of facts that occurred. But because of that situation, there are so many other things that have been put in place. And so we perish for lack of knowledge. We miss out on opportunities because of the fear of listening and not knowing the facts. And so in this journey, I began to help educate people to understand. We grew up, some of us, in a generation where mom and them say what happened at home stays at home. You don't talk about your business. So you get a diagnosis and you don't know who else in your family has the diagnosis or going through. Why? Because you were raised to just not talk about it. But we're a different generation, and I'm not saying that the things that we learned back then were wrong, but knowledge is power. And we have to educate, and we have to talk, and we have to teach, because I am the mother of 5 kids, ages 14 to 34. I thought I was a really cool mama, until my oldest daughter went away to college, and she said, Mom, you're a junk food mommy. And I said, I'm not a junk food mommy. And she said, taco night. I said, okay. Pizza night, spaghetti night. So I was a working mom thinking I was being creative, but I realized that my children did not realize that there was a color to vegetable other than yellow for corn. And so as I cried when God blessed me with the last baby, because I thought, I already have 4, why do I need another one? But I realized that in my blessing, it was so that I could do better for the things that I didn't know then, as far as teaching about healthy eating, about being able to enjoy the foods that we like, but having things in moderation and portion. As you say, being able to introduce our kids to other things to know that it's more than yellow to a vegetable. And so, in being able to be out now and partner with SWIO, I do the Save a Lot grocery tours in partnership with the University of Chicago, and I see some of the participants here. I teach people to know that without enough insulin in your body, you will die. So insulin is not a death sentence. It's a what? Life sentence. Because if you don't have enough insulin in the body, you will die. And so we have to educate people so that they can understand. And I always, just to give you a little about healthy eating, you take the round circle that looks like the plate, right? The plates have the border on it. You stayed in the store forever and picked out that design, right? But then you cover the whole plate and never see the design, right? So the center of the plate is where the food goes. The design is so that you can smile and say, this food tastes good, and it's on a plate that's looking good too. So then you take that plate and you divide it in half, and that's the smile. Your body says, I like these kind of foods. And what kind of foods are they? They are your non-starchy vegetables. What are non-starchy vegetables? Anything other than corn, peas, or potatoes. Your non-starchy vegetables are everything except for what? Corn, peas, and potatoes. Well, how do you remember that? Throw sweet in front of it. Sweet peas, sweet corn, and sweet potatoes. It does not mean you can't have it. It's just that your heart enjoys the other vegetables more, right? So that's the smile on the bottom. So half of your plate is filled with that smile of the vegetables other than what? Corn, peas. Perfect. Now you're going to take that other half and divide it in half, and that's the eyes watching you. Saying, I see you. I'm watching what you finna put in here. I'm watching. I see you. So one of the eyes, think of it as your starches, which is the corn, peas, potatoes, rice, spaghetti, pasta, macaroni, and cheese. That's a portion size. And then the other size would be your meat. And it's best to have grilled, broiled, or baked. Can you have fried, Sheila? Yes. Should you have it every day? Once a week? But you can pull the skin off, but I don't want fried chicken without the skin. I know, I hear you. So then you just make it a treat once a week. And then I always tell people to throw some ears on it. Now it's starting to look like Mickey Mouse, right? So one serving is your milk and dairy. The other serving is your fruit. It's better to eat your fruit than to drink your fruit. Why? Because it takes more fruit to make juice than to just eat it. And so when you have diabetes, you want firmer fruit, because the softer the fruit, the juicier the fruit, makes the blood sugars go high. So if you're going through chemo and you already have high blood sugars, then those foods are going to keep making the blood sugars go up, right? But we know that the levels will go down once chemo is over. And so when you look at the dairy, again, somebody might be lactose intolerant. So you can have some cheese, you can have some yogurt. And so my role in partnering with SWIO is because we go out to educate. And we know that there's so much that you're going through, but we want you to have that joy. I always say this, I may have diabetes, but it doesn't have to have me. I'm more than a conqueror. Cancer may have affected my body, but it's not going to defeat me. I am more than a conqueror. And so when you have that positive attitude and you start to look at things, an attitude of gratitude leads to beatitude and platitude. Learn to be grateful. Your blessings will come. God will take you higher and higher so that you can be here sharing your testimony to lift somebody up, to know that I went through something. I didn't stay there. I went through it. And because I went through it, I am victorious. I am more than a conqueror. And so we celebrate you today as survivors because you went through, but you didn't stay in the storm. You came to encourage somebody else. So I thank you. God bless you all.
Thank you, ma'am. So last expert panelist is Dr. Tanya Payton Campbell. She earned her doctorate. She earned a doctorate of pharmacy degree from Xavier University of Louisiana College of Pharmacy. She is currently a registered store manager and clinical pharmacist with Walgreens Company in Chicago. She collaborates with the providers and case managers at her site, including Access Grand Boulevard Clinics, aggressively practicing pharmacy in the community that's often plagued with multiple disease states, chronic health conditions, including HIV, hepatitis B and C. She provides comprehensive healthcare services to its residents, including dispensing medications, counseling, and helping to solve patients' billing issues, which is important, in order to achieve full insurance coverage for treatments. Dr. Payton Campbell serves as a facilitator of health ministry for St. Philip Neri Catholic Church in Chicago, locally and nationally.
Thank you very much. It really sounds good when you hear it. So the main thing we're all up here to talk about is what we're passionate about. And anyone who knows me knows that I am passionate about community. I am passionate about health education. I am passionate about collaboration. I am passionate about having people take their medication correctly. I'm passionate about having people understand what they're taking. I am passionate about being an advocate. So that leads me to what I do day to day. So typically, I'm not the person anybody ever wants to see. Most of these smiling, beautiful faces in here today come to me not looking so happy. And I do understand, and I do have compassion for you. Many people do not want to take prescription medication. They do not want to have anything to battle. They don't want to have disease states. They don't want to have cancer. They don't want to have diabetes. And they don't want to have HIV. They don't want to have hepatitis C. The light at the end of the tunnel is me. So I invite everyone to come visit me at my pharmacy, because when I have you and I take hold to you, I have a commitment to make sure that you are treated well, that you are treated properly, that you have the correct medications, that you do not have any contraindications, that you do everything that you want to do. You have no limitations. This is what I do day to day. Working right alongside with physicians, providers, nurse practitioners. I've even worked with chiropractors in their office. And my main job, which is surprising, was to find out how people could be taken off of medication. Before that chiropractor started with a patient, he said, "Can you please look over what they're taking, their medical history, and let me know if it seems like they need to be on all of these things?" Many times, not at all. Many times, we were able to eliminate all of their medications and heal them naturally, heal them properly, the way God meant them to be healed. So, every pharmacist is not bad. We don't all work for pharmaceutical companies. Matter of fact, we don't work for them at all, okay? So the things that are needed, the things that you have to take, for short periods of time, even for a lifetime, speak to someone, speak to a pharmacist, someone like myself, so that they can educate you and help you along the way. You want expertise in anything you do, so please reach out to the pharmacist. Many times people have wonderful relationships with their doctors, and they should, and they trust their doctors. But we also work right alongside with your doctor. We're partners. Sometimes I've had the doctors come right to me and say, "Oh, God bless you. I'm glad you caught that," because it may be something that they overlooked, a simple mistake, or even not thinking about, hey, this person has already taken something else, or this person has this allergy, or something to that effect. So working together, working collaboratively is where I feel I'm most needed. I'm very excited. This is my first year working at the Access Clinic, along with Lady Beulah Brent. And she and I met initially. I had to go in and sell myself. It was pretty easy to do. But the main thing was that she trusted me. And that makes a world of difference. So I just want everyone to understand that you are not alone. You have to always give yourself, health partners, advocates, someone to talk to, someone to ask questions. Everyone that knows me knows my phone rings all the time. And everyone that knows me knows that I answer all calls, even the ones that say unavailable and private. You never know when someone really needs you. But I know that the experience I've had, I've done diabetes education for years. Now I'm trying to expand myself. I've been doing HIV for years. I just started in class for hepatitis C. I'm going on to oncology in the next year. So I am committed to helping everyone, to educating you, to seeing you through, because it's definitely necessary. Thank you.
Thank you so much, speakers. So now it's your turn. I know there's many of you out there that have some burning questions. And so if you will, we're gonna, myself and Lady Rochelle, we are going to tag team. I'm going to give her the mic. If you could come, if you have a question, if you could come up to the middle and then ask your question, and then we'll make sure to, wait, okay, right there. So, which one? You want to stand and have them come up? Yeah, and then they're going to share this with you. So if you could, if you have a question, can you please come up to the mic stand? I know you guys are not shy.
Right there.
Wonderful. Okay.
Right there, good. Yeah. No, it's good right there.
So if you could, when you ask your question, say your name, and then direct the question to the panelists.
Hi, my name is Patricia Ellis, and thank you all so much for participating today. It's my first time at this event. Look forward to it in the future. My question is more so to the pharmacist right now, or maybe you all may want to chime into something. But I'm Patricia Ellis. You hear that? Okay. And my question is to the pharmacist. And my question is that I was receiving chemotherapy, and just if you have any insight to share with us, is that I stopped it because it was too toxic for me. And they gave it to me. My cancer was contained within the tumor. It wasn't in the margins. It wasn't in the surrounding tissue. It wasn't in the lymph nodes. And they gave me an amount of medicine, chemo, for metastasized breast cancer. And I'm like, why are you giving me this? And so I stopped it. And one of the things that you said that I solely agree upon, I'm healed from that. I trust God. I put all grace and glory to God and thanks to God, because the cancer was contained within the tumor itself, and it didn't go beyond. So I do believe God has something for me to do. I don't know what it is, but I'm calling out for that word.
I think you're doing it right now.
Well, amen. I mean, I can't see that, but I just need to know what do you have to share in that, because I quit it and I'm starting a little cancer discussion group, because I need to hear others, their testimony of what they went through and what they did to maintain themselves one day at a time.
It sounds like you have all the answers. And I'm not being funny. This is exactly what happens many times. Medications, chemicals, these strong chemicals can be very toxic. They can be too strong for a particular person. We have what we call individualized therapy. Many times, especially I see it in chemo, that is not utilized at all. People do not look at the person. They do not look at their family history, their medical history. They do not look at even all of their tests that show what your liver function is, your kidney function, whether or not you're able to clear medication, whether you keep medication in your body for a longer period of time. This is how things should be dosed. This is how things should be treated. And many times it's a flat regimen that they give across the board. It's only one regimen that the insurance pays for. It's only one regimen that's on the formulary at that hospital, at that site. And the thing is, getting with other people, just like you stated, hearing their stories, hearing what they had to go through, that experience has been a teacher. That experience has opened up doors for people to go to better facilities, to actually get with experts, to have that expertise, to actually look at the patient as an individual and not as a whole, not as just a chart and say, hey, she's got breast cancer, we're giving her this.
I just wanted to introduce really quick is that the doctor had told me that, I hope you all can hear me, the doctor had told me that I was having so many side effects, harsh side effects, and a lot of my stomach, bleeding bowels, I had to go to the hospital because just blood. And the doctor said, well, in the hospital, she said, well, I probably will reduce the toxicity. But then when I got home as a follow-up, she said, I would not reduce the toxicity unless you have severe neuropathy. Now that was the kicker for me.
Right. How sick are you going to make me? This is the question. Right. And this happens many times. They actually want you to go as far as you can, to take you to your limit. You're at your limit when you get started. Dr. Powell talked about that. Many times you're already there. You have no idea what stress does to your body. Stress will not allow your organs to accept and run properly and act properly. So you don't have to get severe neuropathy before they stop. If they are not willing to stop, that should not be your doctor. And they have to listen to what you are saying. It is inhumane to make people go through all of that.
When I prayed, I sought advice first, because the Bible says, with many advice, your plans will succeed. I prayed, I sought advice, and God gave me peace when I decided to stop. And that peace felt like I was sitting on a country porch with the wind blowing past me. But the fear that I was living in, I felt I wasn't going to live much longer.
Well, the thing is, we are in the right place at the right time. This is the place of God. This is the place of the Lord. Many times, people don't like to hear people in the medical field talk like this, say things like this, but I've had experience as well. I actually have not, experienced anything myself physically, but I've had to deal with my parents. I've had to deal with my grandparents, close friends, aunts and uncles, things like that. I've had them tell me, my mother, she was already brain dead. Go ahead, we're going to pull the plug, things like that. I said, oh no, we're going to do these other things. We're going to do something else, and I'm going to call my prayer warriors. Yes, I did tell the doctors every single medication to put my mother on, and I know that helped. And I did have my prayer warriors come in, and when they put that sheet over my mother's bed, and she woke up, and the person that was brain dead was still doing income tax the next year, the doctors still, to this day, know me. And they say, you know what? It's a cardiologist. He says, when I'm teaching my students, just to bring them down a level so that they won't have that God complex, I tell them your story. He said, I tell them the story because at the time I'm telling them about collaborating with other physicians, getting to know their pharmacists, getting to know, other healthcare providers. But he said the main thing was everything that you told me to put your mother on, he was in disagreement with. But he said, go ahead and try it. Because they were so sure nothing would work. And then, on top of that, just the faith that we had and the prayers that we had, he said, he teaches now that if someone says God is going to heal them, you better listen. So I believe that just having the knowledge and not being fearful to stop your chemo when you know this is not the right thing for you, you have to keep praying. And God is going to give you exactly what you need. If you need to be on chemo again, you're going to get it, but it's going to be the proper dose. It's going to be given to you the way it should be. Okay?
Hello, my name is Pamela Russell, and I have a question for you, therapist. Ever since I found out in 2014 I had breast cancer, I went to the doctor, to a specialist, and he told me it was in my mind, there's nothing wrong with me. Stop going on the internet. The internet doctor is the one that diagnosed me twice. The blog. So I don't really trust doctors too much right now. So I can't sleep, that's my problem. I haven't slept really in like 3 years. They talked me to have a reconstruction, and I've been in chronic pain for 3 years. And the doctor left the country and I can't find him. So I want to know, what can I do about sleeping? I already tried natural stuff, tea, melatonin. I even take a volume. I still don't sleep for 1 hour.
Okay. So thank you for your question. A few things, and I'm going to get, if you want to have a seat, go ahead and have a seat while we're answering.
Yeah, I'm going to get surgery 6 weeks ago, so I can't stand up.
Okay. I'm going to get to the sleep part, but I wanted to also make sure I followed what you were saying in the beginning, that you were diagnosed with cancer. Okay, so you were feeling something. You thought there was something going on. Okay. All right. So one thing I want to emphasize both with your case as well as with the other case, and you all are going to freak out when I say this, but when people graduate from law school and they're the last in their class, we used to have a joke. What do you call them? Waiter. If you graduate in the last of your class in medical school, what do we call you? Doctor. So just because you have someone who is a doctor does not mean we know what we're talking about. So, and I am a doctor saying that, but we don't know everything. And you all have to feel comfortable enough to advocate for yourself and say, I'm sorry, you don't know what you're talking about. Go to another doctor, get a second, third, fourth, fifth, sixth opinion, whatever it is you need. But I'm happy that you did get the diagnosis and the treatment you needed. Yeah, that's sad that it came off the internet. But I'm still happy that you didn't just stop with, it's in my mind, and went down that road. So that's another story. If we have time afterwards, we'll talk, because they do have licensing boards and complaints and everything else. But as far as the sleep, it sounds like you've already tried a lot of things as far as vitamins. I heard you say melatonin, tea. Another thing is routine, and making sure you get a good routine and eliminating certain things that can interfere with your sleep. So there's some children in the room, so your bedroom should be used for two things: sleep and something else. Y'all figure out something else. It should not be used to sit and watch TV. Okay.
Yeah, that's another problem.
All right. It should not be used to snack. You should reserve your bedroom for those two things. So that way you're training your mind and your body that when you go in there, it's one of those things that you're going in there for. Not, oh, are we supposed to be watching TV right now, or are we supposed to be sleeping right now? You don't want to confuse your body for that. The other thing is Also look to see, as you said, you have to sleep sitting up. There may be something that you might need a different type of bed, where sometimes you need the bed that's going to elevate your head. You might need a different type of pillow. I just paid $40 at my chiropractor's office because I'm a side sleeper. He kept trying to get me to sleep on my back. And I'm like, I'm 45 years old. I can't change at this point. Which he disagreed with, but I tried it for 4 nights, and those were the worst 4 nights of my life. So sometimes you might need to get a different pillow. But routine is important. If you're able to exercise, let me rephrase that. Find the exercise you're able to do. Okay. Build that into your routine. Try not to do it too late in the day, because that can...
Wait, I'm thinking. My brain won't shut off. That's the problem.
Okay, thank you. Meditation, journal. Yeah, meditation, journal. And then try to stay away from the caffeinated beverages, things that can cause reflux, so acidic foods, tomato sauces, all of those things can help. And I think I hear some other suggestions as well.
Like she said, as far as the food, nightshade vegetables, big with environment at nighttime, making your room an environment that you go into. If you have a routine, your body literally can and will slow down. I know I get a lot of insomnia, and it's sometimes your nervous system can be overstimulated, and with stress, it can cause tension in different areas. And with a lot of my practice members after chiropractic, it literally helps to relax the body and reduce, and they can sleep. All right, so that's a great thing. And then, like she said, it's a multitude of things, but it's more so looking at your history. What are you drinking? What are you doing during the day? I mean, because everybody definitely has things on their mind, but there's a way that you can train your body to wind down as well. So.
My name is Don Doty. I'd like to ask 2 questions. One is, why is HIV so prevalent right now within the heterosexual female population? And then why is hepatitis C so prevalent now within the older senior population?
Okay, so for the HIV, you said in heterosexual women? Well, it's a few things, and especially with African American women, unfortunately. A lot of times, well, heterosexual sex is how they contract the HIV, first of all. So these are men who gave them the HIV. Now, whether it is that men are actually sleeping with other men, or what we call MSM, or a lot of times, especially in African American community, it has to do with incarceration. Men are incarcerated. Things happen to them in jail. Some things are voluntary, some things are involuntary. Most things they will not talk about. They block out. But when they come out of jail, they have several women waiting for them to come out. Or they, just come out and they want to be with several women because they were locked up. And that has been a way that it has spread, especially among African American women. As far as the hepatitis C, it's a very easy answer to that. We have what we call baby boomers, so that's that age group that you were talking about. During that time in their life, in their youthful life, there was a lot of drug use, IV drug use, just social drug use. And that caused a lot of spread of hepatitis C at that time. A lot of times we have patients that come in and they don't want to admit to it. Also during that time, because of blood transfusions, blood was not screened properly at that time. Just like you could have contracted HIV initially until they started actually screening blood for that. So the same thing happened with hepatitis C. But many times with that age group, there was a lot of partying and passing around syringes and things like that. So that caused a lot
Yeah, I'd like
of
to
that.
mention though that one of the studies show, and I've done some studies in that area, that during the war, during 61 and 75, all us guys that went to Vietnam during the war, we were affected with hepatitis because of the faulty air gun. And I like to stress to everybody in here, if you got a grandparent, mother, father over 65 that has or was in Vietnam, they are totally at risk for hepatitis C. I had it 50 years and just now 3 weeks clear. So I really stress it.
Very good. And the thing that's great about it, right now that's the best virus to have. I know that sounds crazy, but the medications that they have now completely eradicated and without side effects. They're very easy to take, and it's within 8 to 12 weeks. They're extremely expensive, but if you come to me, I know how to get it paid.
Hello, I am Carla Turner. I am a survivor. I just completed treatment in October 1st. I completed radiation. Praise God. I am cancer-free. My question is living after it's all over with. And I'm glad that we have a psychiatrist here. I will gladly admit I had to go to counseling when I was diagnosed, because as an independent black woman as I am, having that diagnosis knocked me off my feet. To have to ask for help was very difficult for me, because I was used to being the helper, not the helpee. So my question is just trying to move past that diagnosis. For one, physically, prior to my diagnosis, I was in the gym. And now I'm finding myself not having a lot of energy. I am taking vitamins. I'm also on tamoxifen, which I have to take for 5 years. So I'm having a very difficult time getting back to a routine of getting back into the gym, working out. I worked throughout my cancer treatment. I'm back at work now. By the time I get home from work, I am just exhausted. So trying to go to the gym after work. In the morning, there are days I wake up tired, and I still go to work anyway. So my question is, any advice on how to just get back to that routine of physically back working out? And I guess I want to get back to where I used to be, and I don't know if that's possible. I'm still grappling with that. Just how do I get back to that life that I had prior, actively, physically?
Well, the biggest thing is taking your time. How do you eat elephant? One bite at a time, right? So when starting with getting back in the whole physical arena, is putting yourself on a limited time schedule, doing exercises that, number one, that are the very best right now for you would be cardiovascular, increasing blood oxygen, working all your muscles, whether it be walking, elliptical bike, swimming, something that you can do 30 to 40 minutes a few days a week. And then making sure, number one, your body's properly hydrated. If you just fought cancer, one of the biggest things because right now everybody's body is fighting cancer. Now you're past the stage, so proper hydration is something that's critical, because now you constantly want to be in a stage of flushing toxins out your system, and even stress hormones. And then if you're doing any type of supplementation, making sure you're taking the things that your body is deficient in. And then definitely talking with your pharmacist to make sure that there aren't any contraindications. The biggest things everybody in his body is deficient in today is your omega-3 fatty acids and your vitamin D. Something that's really good to cycle on and off. I say with my patients, due to the fact that there's antibiotics in all the food, as far as meats that we eat, is a good probiotic. 1 week on and 1 week off, just depending on where you're at. And taking time to be fulfilled on your passions. What are you passionate about? And not what you do for your cousin or your sister or your brother, or how you help this. What are you passionate about? How are you fulfilled that you can do it in a room by yourself, not needing anyone else to be a part of that, and throwing yourself into that? every once in a while, a little bit every day. All of those things will attribute to building your body back up. Because like the sister said, she said she was reformed to something even greater, and that's the journey you're on right now.
Thank you so much. I want to add one more thing. I would say everybody in here can testify to the fact that you have been through something. Cancer may be one of those journeys, a journey through, dealing with diabetes. But as people of faith, God never said that we weren't going to have to struggle, right? We all can agree with that? When you surrender into that struggle, you tap into the power and allow him to do what it is he needs to do with you. So you become the vessel, right? During that journey, appreciate the moment. You have gone through the fire, you're a warrior, and you come out on the other side. And the journey, the part of your journey that you're in right now is different from where you were many, many months ago. So oftentimes we're so reflective on who I was yesterday that we can't appreciate who I am today. Who I am standing in this blessing, in this moment right now. And so I agree 100% with what all the panels have said, but I just wanted to share with you, because as I reflect on some of the things that I may go through in my own journey, I have to kind of pause for a minute and hear God say, be still. Be still. And often, especially for us who are doers, that is the hardest thing in the world to say, is just be still and stand in that faith. And so that was just something that came, and I just want to share that with you, is as you give yourself time to heal and kind of get back to whatever the new normal is, just be present for yourself in that moment every day. And then I also want to say one more thing. As a public health professional, one of the things that challenges me so much and that frustrates me so much is the fact that we do have a number of different physicians who are a part and who are within the community, represent the community, are committed to the community. And then we have some physicians who, well-intentioned, but don't understand what the struggle is. And so the advice that they may give you may not be representative of what you actually need at that moment. But in order for you to get what you need, you have to be the person to demand that. You, in the person that you are, deserve quality health care, and don't let anybody tell you any differently. There is a standard of care that every patient is supposed to receive. And one, God has given us 5 senses and 6 to know what to do with them. And then 2, there's a number of different advocates like Sisters Working It Out and so many other organizations that advocate on your behalf if you feel like, I don't quite know, I know something's wrong, but I don't quite know how to articulate that on my own. There's a number of different women who are out there, a number of different men, organizations, advocates who can go to your appointments with you to make sure that what you're being told, that you understand that. Because at the end of the day, it's you. The medication is being given to you. All of that is informed consent. When a doctor is sitting here and telling you, here's your treatment plan, they're expecting that you understand what is being told to you. So when you don't, it's so important for you to be able to say, you know what, you need to hold on for a minute. Because whatever the 5 words that just came out of your mouth, I don't understand 4 of them. So I'm going to need you, I understand ma'am and nothing else. So you really have to push yourself to step outside that comfort zone to make sure that you understand what type of medication they're suggesting, what the process is that you have to go through, and it is okay and right for you to be able to demand that. And that's not just with cancer, that's with healthcare in general. We have to participate, we have to be active participants in our own healthcare and demand that the physicians show up and participate in that process collaboratively.
I was going to add that in that sometimes in our community we forget that the physicians work for us and that we don't work for them. They literally work for us, and we can demand that treatment. So sometimes we don't know that, but you do have that voice.
And the only thing I wanted to add to that is just a note for everyone. In this state of Illinois, each state is different. Each state has its own board mandating medical professionals. Just for instance, for pharmacy, it is a law now that every pharmacist is supposed to talk to you about your new medications. I go to the counter every single day and talk to people. And people look at me like I'm crazy, like, why are you telling me this? You know, or I'm in a rush, or I don't want to hear this. But I still tell them, and I still have to tell them. And it's not so much that it's a law now, but it's something just like you said. It's your right. That's what's supposed to happen. That's what they're there for. So when you're there and people say, do you have any questions? Please say yes. Please say yes. Or just hear them out, whatever they're going to tell you. Because it's been many times I start telling people, and they're like, no, I'm not sick. That's not what I came for. And I say, well, yeah, this is what this medication. Oh, no. And we find out that's not even what they're supposed to be getting. Okay? And I mean, I don't want to scare you, but it's been times when the prescriptions were just confused. They wrote it with someone else's name, but that was what they were giving the other person. And if it was not for me telling them, hey, you're taking this for anxiety, you're taking this for diabetes, they're like, oh no, I came to get a muscle relaxant. I can't. So please, 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 if you don't take any other advice, take that advice.
And so I just want to add, as a provider, you all know there are good providers out here. And so I try to give my patients the best care possible. But one of the things that we teach also is when you go to see your provider, have a list. Write things down that you need to talk about and prioritize what's the top 3 you need to accomplish today. Because I'm sorry, we don't have all day and we don't mean to be rude, but on the other side, it's a business. And so if I'm in the room with you and I only have a 20-minute visit, and I'm with you for 30, 40 minutes, the patient behind you is upset. So when I walk in the room, they're busy yelling about me being late. They don't want to hear that I needed to spend that extra 10 minutes with you because you didn't understand. And so I'm saying that when you're at the office and you're having a doctor's visit, think about those things and have the compassion for the person that might have been ahead of you, that needed a little extra time because they didn't understand. And as a providers, we really do our best to stay on schedule, but sometimes it's hard because you don't want to let that patient walk out the room and not understand what they're taking or why they're taking it. And I can just speak as a provider. I try to make sure that when my patients leave that room, they know what they're taking, why they're taking it, and it was a shared decision. Because I can prescribe all I want, but that doesn't mean you're going to take it. I can prescribe, and if you don't tell me you're not taking it, your lab results are not reflective of the truth. So you have to be honest, you have to tell the truth, you have to make a list, because we can accomplish a lot in a 15 to a 20-minute visit when we come and you have your list and you're prepared for your visit. And take a piece of paper to say, I'm not going to remember everything because I'm still stuck on that one thing you said to me and I can't get past that. But we can take the time to write it down. And when you leave, there's an after visit summary. You should have that. And it details what happened during the visit, what we talked about, so that now when you get home, you have that printout that you can read and share with somebody else. There is my chart. Electronic medical records, where you can go into your chart and read it at home. So there are so many things that we can do as patients to prepare for the visit so that way we don't feel overwhelmed, because again, there are a lot of great providers out here and we know that some things doesn't go exactly as it should, but these are the things that we want you to be prepared to do.
Can we all give our experts a round of applause?